Hi, welcome back. We're still talking today on water birth. So this is actually a two-part series. The first was the actual pool, how to inflate, deflate, and things like that, and what that looks like. And today I want to talk to you a little bit more about water birth as far as its benefits and kind of just some more general information on water birth. So the benefits of water birth, like immersion in water, would be as we discussed before, your increased relaxation, your mobility in the water, your buoyancy, it helps take some of that strain off. Pain relief. We also have, it's more of a feeling of safety for the birthing person. She's in this cocoon type environment, this warm, homely environment. She's relaxed and she just feels safe. We also have the potential for an easier birth for the mom or for the birthing person, as well as easier transition for the baby, which we discussed in the earlier video. The potential for that, and it can also lower blood pressure and the anxiety and help decrease the pain in labor when you're in the warm water. And we can also have a less chance of episiotomy. As we had talked, some people say an episiotomy, we talked about, that's the cut. Like if somebody has to perform a cut to make the opening wider between the vaginal open, cut down the perineum to make room for the baby to come out more, and we have less chance of having to do that. So birthing in water, it can be a safe option for families. It's been seen to, it doesn't affect the baby's apgars, it doesn't affect, anything like that. It decreases the risk of being able to have to be, in neonatal care and things like that in the water. The planned water birth attended by a licensed care provider, they've shown they don't really increase the risk of infection or anything like that. You just need to take care of that. If you have open wounds or cuts, or say that have the mom or the birthing person may have herpes lesions or MRSA or something like that, of course you don't want to get in the water because you may have the spread of infection through that. Use your judgment and be safe, but generally most of the time, barring anything like that, it's very safe and very relaxing and a great transition for the baby after being born. There are some situations that might contraindicate giving birth in the water, as we talked about, the herpes lesions or the MRSA. Interpartum bleeding, if you're having the birthing pregnant having a lot of bleeding. The maternal temperature greater than 100.4, so if you're running a fever, you don't want to birth in water, of course, because you may have an infection somewhere, and then there you go. If you have non-reassuring fetal heart tones, so the baby's heart rate is not doing as it should, you may not want to birth in water, because it's going to be quite the task of having to get out of the water, if something was to happen, and anything like that. So, and also you have to take into effect you're in water. So if you're in water, you're not really going to want to drink a lot, but you're going to have to make sure that you do stay hydrated, even in water, even during a water birth. That's very important to stay hydrated, because as you're sitting there in the water, you may not feel like you need to drink any water, but yeah, you really do. And ideally, the water should cover the mother's abdomen, completely, cover completely. This gives greater ease of movement in the water, and it prevents the baby from breathing in water accidentally, because babies are born with something called a dive reflex. So as they've been in water, this whole time, and then they transition out from birth into water, their lungs are not yet open. They're still in that water atmosphere, and they're still transitioning easily. So as you want to go to bring your baby up after the baby is fully birthed, you want to go to bring your baby up, you want to make sure to bring your baby up face down, because there's this reflex when the air hits the baby's face, they will take that first breath. And you don't want, as you're bringing the baby up out of the water, the air accidentally hit them and then they take their first breath and they gulp in water. So if possible, you want to try to raise them up with their faces down, with their heads up, and raise them up out of the water like that. If there is a nuchal cord, which we talked about the cord of the baby from before. So that would be if the cord is wrapped around the baby's neck, is what they call a nuchal cord. Generally, this is no problem. The cord is covered with what they call Wharton's jelly. It's this really slimy kind of jelly stuff that makes it to where it doesn't clamp down. But it can happen if the baby is, like we said, born with a cord around its neck. Just before the midwife or yourself, before you take them up out of the water, you will just slip that cord off gently and easily, and then proceed to bring the baby up out of the water with the face down, if possible. So after that, then you place them to mom's chest and just go from there. So with the cord, like we said, that Wharton's jelly, if the cord is wrapped around the neck, generally that's not a problem. Generally, just take it on off. Or if we see the baby's head and it's crowning, we see the cord wrapped around its neck, as it comes out, we'll just slip our finger under and just loop it off, just like that. So, let's see. And like we said, the temperature of the water is generally kept between, I said 100 to 98. Can go down to 95, but we really like to keep it up around body temperature, so that, and it's to never exceed 100. If while you're filling it, it does, you can add a little more cold water, or, if you haven't got in yet, don't worry about it, it'll cool down. But if the water's too hot, the baby could become overheated, or you could become overheated, and nobody wants that. But, so then, like I said, there's benefits of water birth, and there's also situations where this may not be ideal. Just like as we were talking about earlier about your birthing locations and your care providers, this is something you'll want to research on your own and come to a decision of what's best for you. I mean, I know there was that saying, birth how you live. Well, I really believe that, birth how you live, how you want to, want this baby to be brought into the world, and in the most calm and peaceful environment with such an easy transition, so that, later on there's nothing to have to really process over, and, there's no complications or anything due to, interventions that may or may not have took place. So you definitely want to research everything and just make the best decision for you. But anyway, so like I said, recap: water birth, temperature, roughly 95 to 100, but keeping it within that range of 98 to 100, somewhere up in there, like your body temperature. Relatively safe. Reasons you wouldn't want to do a water birth: if mom has MRSA, open herpes lesions, intrapartum bleeding, you're running a fever, or unreassuring fetal heart tones. And I know some midwives would like for first-time moms to not birth in water. That way they're able to monitor more closely, and if something was to happen, or they're actually able to perform more support to the perineum to make sure nothing tears. But you can also use in the water flashlights and a mirror and still be able to provide support that way. But it just kind of really depends on the midwife and yourself and your circumstances going into it. But again, if you have any questions or would like to talk further or have more information, you can shoot us an email, info@southernhomegrown.com, or go to our website, to our contact page, and shoot us a message there, southernhomegrown.com. Have a great day. Thank you.